Welcome back to another episode of HealthCap Weekly Wrap. This week, we're diving into new national CPR guidelines, a major federal audit under PDPM, a research-backed mindful eating program for older adults, and a policy initiative that helps first responders recognize hidden disabilities.
All right, we've got a full plate today.
We really do. Some big clinical updates, some compliance pressure, and then a couple of stories that really center on residents.
Let's start with the clinical headline. The American Heart Association released the 2025 highlights of the guidelines for CPR and emergency cardiovascular care.
Oh, another update already?
Yeah, and this one's substantial. This isn't just a tweak here or there. The highlights document summarizes 760 recommendations.
760? That's a lot.
It is. It spans adult basic and advanced life support, pediatric life support, neonatal resuscitation, post-cardiac arrest care, systems of care, ethics and resuscitation decisions, in special circumstances like pregnancy, hypothermia, opioid overdose, trauma, stroke, even patients with LVADs.
Wow, so it's not just about compression depth and rate.
Exactly. And there's also guidance on extracorporeal CPR, public access naloxone, and a full section on education science.
Education science?
Yeah, they talk about simulation, feedback devices, structured debriefing, virtual reality, even gamified learning. It's not just what to do in an emergency, it's how we train teams so they actually perform well under pressure.
That part really hits home for senior care communities. Because when something happens, it's rarely just one person responding.
Right. Now, the guidelines themselves aren't written specifically for senior care, they're broad. But many communities provide skilled services, and even those that don't still have to respond when a resident experiences a cardiac event.
So what should listeners actually do with this?
I'd say start by asking, are we aligned with the most current AHA science? When was the last time we updated our CPR training? Are we practicing coordinated response? Are we debriefing after drills?
And are we using tools that actually improve skill retention?
Exactly, resuscitation science evolves. If we're not evolving with it, we fall behind.
All right, let's pivot to something that might make some leaders a little uncomfortable. This story comes from McKnight's Long-Term Care News, and it involves the Office of Inspector General launching PDPM audits.
Here we go.
Yeah, the article reports that the U.S. Department of Health and Human Services Office of Inspector General has formally begun auditing Medicare claims under the patient-driven payment model.
And this isn't theoretical.
No, it's not. In the first completed review, they looked at claims from Pinnacle Multicare Nursing and Rehabilitation Center and found that 99 out of 100 sampled residents allegedly had incorrect PDPM claims.
99 out of 100? That's almost all of them.
That's what the report states. And when OIG extrapolated those findings across a broader set of claims, they estimated about $31.2 million in overpayments.
$31.2 million. That's massive.
It is. Now, Pinnacle strongly disputes the findings. They've cited pandemic-era conditions, differences in how documentation was interpreted, and concerns about reviewer expertise.
So there's tension here. It's not just open and shut.
Right. But regardless of how that dispute plays out, the larger signal is clear. OIG is auditing PDPM claims. They're using statistical sampling and extrapolation, and they're looking closely at coding accuracy, clinical documentation, HIPPS code selection, and verification of skilled need.
And the article notes they're already auditing additional communities.
Exactly. So this isn't isolated.
For senior care communities that provide skilled services, this should prompt some serious internal reflection.
Yeah, not panic, but reflection. Do we have strong internal auditing? Are therapy, nursing, and MDS teams aligned? Are we clearly documenting skilled need? If someone reviewed our charts 2 years from now, would the story be obvious?
Because when auditors come in, the documentation speaks for you.
It does. And in a PDPM environment, precision matters.
All right, let's move into something a little more hopeful. This next story comes from Mather Institute and focuses on their Nourish to Flourish mindful eating program.
Oh, I liked this one.
Me too. This is a 4-week mindful eating program designed specifically for older adults. It's outlined in an orange paper, and it's supported by a structured participant workbook.
And it's very focused. It's not just broad wellness language.
Exactly. The program includes guided meditations, sensory eating exercises, group discussions, journaling, and weekly take-home practices. It's designed to help participants better recognize hunger and fullness cues, reduce emotional eating, cultivate gratitude, and develop a healthier relationship with food.
And they actually evaluated it.
They did. The pilot study was conducted across 7 senior care communities. Participants reported high satisfaction, and there were statistically significant improvements in mindful eating behaviors, healthy eating identity, self-reported health, spirituality, and other positive wellness indicators.
That's meaningful because sometimes we launch programs and hope they work. Here, there's measurable impact.
Right, and they provide facilitator and participant guides, which means communities can actually implement it in a structured way.
For life enrichment teams and wellness directors, this could be a practical addition to programming.
Absolutely, and food is such an emotional and social part of daily life. Helping residents build a more intentional relationship with food can ripple into overall well-being.
So the takeaway isn't just, that's interesting research, it's, could we offer something like this? Do we have staff who could facilitate it? Could it support residents who struggle with emotional eating or who want to approach nutrition more mindfully?
Exactly. It's evidence-based and operationally ready.
All right, let's close with a story that has a strong human element. This one comes from Maryland Matters and focuses on a butterfly symbol being added to driver's licenses and ID cards in Maryland.
Oh, tell me more.
Maryland has implemented a voluntary butterfly symbol that individuals can place on their state-issued ID to indicate they have a hidden disability. The idea is to alert law enforcement or first responders that the person may need additional communication support or accommodations.
That's powerful, especially for people with cognitive changes or other non-visible conditions.
Exactly. And while this initiative has been in development for a bit, it's still very relevant. It reflects growing awareness that not all disabilities are visible.
For senior care communities, what does this mean?
I think it prompts a broader conversation. How are we supporting residents with hidden disabilities when they're outside our community? Are families aware of identification options like this, where available? Are we educating partners about communication strategies?
It's really about dignity.
It is. It's about recognition and understanding in moments that can be stressful or confusing.
So, as we wrap up, we've covered a sweeping national clinical update from the American Heart Association, significant compliance scrutiny reported by McKnight's Long-Term Care News, a research-backed mindful eating intervention from Mather Institute, and a policy initiative highlighted by Maryland Matters that centers on dignity for individuals with hidden disabilities.
Each story touches a different dimension of senior care: clinical excellence, regulatory preparedness, innovative programming, advocacy, and awareness.
And maybe the thread connecting all of them is intentionality. Being intentional about training, about documentation, about programming, about how we see and support residents.
That's a great way to put it.
Thanks for tuning in to another episode of HealthCap Weekly Wrap. You can get more details about these stories in the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog. We appreciate the work you're doing every day in senior care communities, and we'll see you next week.